Obsessive-Compulsive Disorder, OCD, is a mental condition characterized by recurring thoughts or mental images, obsessions, and repeated actions that the person feels compelled to perform, compulsions, in an attempt to relieve anxiety. As described by psychologist Sigmund Freud, obsessive-compulsive thoughts are the result of unconscious internal conflicts, where these conflicts may manifest in the form of recurring obsessive thoughts or compulsive behaviors. In this research, we will explore the potential causes of OCD and the available treatment methods relying on modern scientific studies. The causes of OCD are due to a combination of genetic, biological, and psychological factors. Below is a look at some of these causes. Genetic factors. Studies suggest that there is a genetic component to OCD, as similar cases are often observed within families. Robert Collins, a genetic researcher, states, "Genes are not the sole factor, but they provide the biological foundation that may lead to OCD in certain environments." Biological factors. Some evidence suggests that an imbalance in neurotransmitters, such as serotonin and dopamine, is linked to OCD. Norman Doidge, in his book The Brain That Changes Itself, points out that neurotransmitter imbalances in the brain can act as triggers, exacerbating obsessive thoughts and repetitive behaviors. Psychological factors. Individuals who have experienced psychological trauma or who suffer from anxiety and depression may be more prone to developing OCD. Jonathan Greenberg, in his book Freedom from Obsessive-Compulsive Disorder, notes that obsessions often arise from the mind's constant attempts to resolve unconscious issues or confront unresolved fears. Affects. OCD has significant effects on the quality of life of sufferers, as it leads to repetitive and often irrational behaviors, which can negatively impact personal relationships and work performance. Sometimes, the disorder leads to feelings of shame and social isolation, worsening the problem. Albert Ellis, a pioneer in behavioral therapy, asserts, "Obsessive thoughts and compulsive behaviors feed off each other, trapping the person in a vicious cycle that affects their mental and social well-being." Treatment. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is one of the most effective treatment methods for OCD. This therapy focuses on altering negative and unrealistic thoughts that lead to compulsive behaviors. The premise is that changing thought patterns can lead to improved behavior and emotions. Aaron Beck, the founder of CBT, said, "If you can change the way you think, you can change how you feel and behave." Different CBT techniques. Exposure and response prevention, ERP. This is one of the most successful strategies for treating OCD. The patient is gradually exposed to situations that trigger anxiety without allowing them to engage in compulsive behaviors. Example: a patient with a cleanliness obsession may be asked to touch contaminated objects like door handles or tabletops and refrain from washing their hands for a set period. Case study: a woman who washed her hands over 50 times a day managed to reduce this to 10 times per day by gradually being exposed to anxiety-inducing situations, such as touching surfaces without washing her hands. Cognitive restructuring. This involves helping the patient challenge and evaluate irrational thoughts that lead to obsessions and compulsive behaviors. The therapist works with the patient to reframe these thoughts into more realistic and rational ones. Example: a patient who believes that failing to check the door multiple times will lead to a disaster is helped to adopt the belief that checking the door once is sufficient for safety. Case study: a patient obsessed with checking doors and windows was able to change his belief that not checking would lead to disaster, and eventually felt safe just closing the door once. Thought stopping. In this technique, Patients are trained to stop obsessive thoughts when they occur by using specific mechanisms, such as saying "stop" out loud or snapping their fingers. This helps break the repetitive cycle of obsessive thoughts. Example: a patient with recurring thoughts of a car accident learns to say "stop" aloud and distracts himself with another activity, such as physical exercise or a conversation with someone. Relaxation techniques. Techniques like deep breathing and meditation are used to reduce the stress and anxiety associated with OCD. The goal is to teach the patient to naturally calm themselves rather than resorting to compulsive behaviors. Example: a patient who feels anxious in crowded places due to a fear of germs learns deep breathing and relaxation techniques, enabling them to manage their anxiety without avoiding public spaces. Social skills training. Some OCD patients struggle with social skills due to excessive anxiety or isolation. This type of therapy helps them interact socially and manage situations that trigger social stress. Example: a patient with fears about public speaking gains confidence through social skills training and role-playing exercises, eventually overcoming their fear of social failure. Combining techniques. Often, multiple CBT techniques are used in combination. For example, a patient may begin with ERP while also practicing relaxation techniques and cognitive restructuring to manage anxiety and obsessive thoughts. Case study: a person with contamination fears began therapy with exposure to contaminated surfaces without washing their hands, using deep breathing to control anxiety. Cognitive restructuring helped them replace irrational thoughts like "I'll get sick" with "touching surfaces isn't necessarily dangerous." Conclusion: CBT is a powerful tool in combating OCD, offering various techniques that focus on changing both thoughts and behaviors. David Burns, a prominent CBT expert, notes, "Compulsive behaviors are temporary attempts to relieve anxiety, but they don't address the root cause. CBT treats anxiety at its core." With commitment to therapy and the right tools, patients can see significant improvements in their daily lives and overcome the symptoms that hinder their well-being.